Hello and welcome to Everyday Oral Surgery. This is your host, Dr. Grant Stucki. I am an oral and maxillofacial surgeon practicing in Denver, Colorado. The goal of this podcast is to connect, learn, and inspire. In this podcast, you'll be hearing from OMS surgeons all over the globe discussing ways to improve the practice of oral and maxillofacial surgery. Most information shared in this podcast will be based on personal experience and opinions, so please supplement what you learn here with approved research studies. Without further ado, please enjoy today's episode. All right, welcome everyone to another episode. Today I'm with Dr. Arshad Kaleem. He is an oral and maxillofacial surgeon, head and neck surgeon, who is joining us on the podcast. Dr. Kaleem, thank you for joining us today.
Well, thank you so much, Grant, for inviting me. I'm excited to talk to you about what we do, and looking forward to it.
Yeah, we've had several listeners reach out, and I think a lot of people are looking forward to this episode. So could you start by just kind of giving us a brief history of your training and your current practice setup?
Yeah, so as far as my training is concerned, I did my dental school first in University of Pennsylvania, and then my residency training at LSU, New Orleans. I also did an internship before that in LSU, New Orleans, as well as LSU Shreveport. Yeah, so 2 internships, and then I started my residency in New Orleans Medical School there as well. And once I finished my residency, I went ahead and did a head and neck fellowship in Portland, Oregon. Yeah,
Very nice.
yeah. So, and then I came back to Miami. I did another fellowship there, microvascular reconstructive surgery, and then I was staff in Miami for 5 years. And now I'm in El Paso, Texas for past 3 years, and we're in a group practice. I have amazing partners, and I mainly focus on oncology and reconstructive surgery, but I also do trauma, dental alveolar surgery, implants, and stuff, whatever comes in every day, oral surgery day.
Oh, that's fantastic. So pretty cool. You're able to use all of your skills and practice full scope oral surgery. Has that been challenging to maintain a full scope practice, or how has that been?
I mean, it's I think you have to be like disciplined about it. There are particular days that I do dental alveolar, and particular days that I have my OR day, and then and just a clinic day because we have to do see a lot of oncology patients. So I have a full day dedicated to oncology, then a full day dedicated to dental alveolar surgery, and then the rest of the week is based on 2 or 3 days of OR. So, and it plays out really well with my schedule.
Very nice. And can you talk to us a little bit about some of the mission trips you do, how frequently you do that, what type of work you do there?
Yeah, so I do go on mission trips for the past 4 or 5 years. I've been going at least once a year. So I started this going to Pakistan. I'm originally from Pakistan, and whenever I go to Pakistan to visit my family, I also kind of like set aside a week for my mission work. And I have a lot of connections with local maxillofacial surgeons and dentists. And when they know I'm coming, they will set aside a couple of cases for me to do them. And also, they have an annual conference equivalent to like we have the AMS conference. They have the Pakistan Local Society conference. So on the sideline of the conference, I'll go and give lectures, and then they will have 1 or 2 surgeries scheduled for me. So I've been doing that. And then last year, I went to West Bank, Palestine, for about 10 days for a mission trip. And recently, a month ago, I just got back from Gaza, Palestine, from another mission trip.
Wow. And when you're doing surgeries over there, I mean, is it pretty smooth? Is it challenging? Do you have all the equipment and things you need?
Well, I think that's probably the most difficult part of the mission trip is you have limited resources, and it's not as if you're operating here in the States where you're used to it, and but it's not just you, but also the people with you that are used to it, right? But when you go to a new place, you don't know what kind of setup they have. what kind of facilities. So
Mhm.
I think that's the biggest challenge of any mission trip is not knowing what you're getting there. So to do that, I think what I do mostly is I pick up the cases, make sure that I know what cases I'm going to be doing, review the cases first, and then as much as I can do, I prepared for those cases before I leave. So most of the cases are reconstructive surgery cases, and I will have the CT scans and everything, their data kind of emailed to me. Then I would plan the surgery, and most of them requires virtual surgical planning because they're advanced reconstructive cases. And then I would talk to one of the companies that I work with, and then they're very generous and nice, and most of them they will donate. The implant. So I'll have a custom plate made here from Pakistan, cutting guides, everything. If I'm doing a free flat, and I just have the whole plan. I take all the instruments that I need, and then I kind of communicate with the local team and that this is what I would need, and they make sure that that's available. So as much as I can do and prepare for the case, I do that. And of course, there are always challenges. Not having a microscope, I mostly operate uh, with my loops. So I make sure I have my loops. And also, my assistant, they usually don't have loops or they have never used loops. I also try to take an extra set of loops with me so that whoever is assisting me can also wear loops as well.
Nice.
Yeah.
Well, that's a lot of work, and so great that you're doing that and helping those who are, probably less privileged than we are here in the United States. In regards to just head and neck surgery and some of the advancements that have been happening over the last few years, what are some of the bigger, I guess, changes you've seen in the way we diagnose and treat patients?
Yeah, I think for the past few years, I think we have seen an increasing role of virtual surgical planning, custom implants, subperiosteal implants, and techniques in reconstructive surgery. I think this is evolving. And then as I see that, I think head and neck surgery as part of maxillofacial surgery was kind of like evolving. When I was in residency, we did not see a lot of head and neck trained maxillofacial surgeons. There were just a few centers, just a few names. But now, since I have done fellowship and I'm out about 8 years now out of my fellowship, I see so many young professionals coming out and doing advanced training in head and neck. So I think with time, I think just like you see cosmetic surgery, TMJ, and head and neck as coming in like super specialty, subspecialties after maxillofacial surgery. So this is the biggest change that I'm seeing, that there is not a trend people formally pursuing subspecialty training. And then, of course, the technique, computer training, AI, um, robots. So everything is, I think we just need to keep up to date with all the techniques. And it's challenging as well as it's nice to see all these developments.
Nice. Has these, all these developments, like you're talking about, the technology, has it shortened surgery time at all? I mean, I ask that because I did training, 15 years ago with the head and neck surgeon,
Yeah.
and some of these surgeries were, could potentially be up to 20 hours long. It was just quite a long procedure. But how has the time of surgery been affected?
Yeah, I think the time of surgery has been reduced, and I think, and more important than time is, I think, is the precision of the reconstructive surgery, and also identifying problems before you go to the OR. Because if there is a problem, you can see it before, like if something is not fitting together. And also, it has also allowed us to do like very precise reconstructive surgery, like a joint in a day, placing implants in the spot in the direction that we need it, and then have teeth and a denture made at the same time. I mean, this was not possible. You can't manually do this. You have to plan this before. And I think these technologies have allowed us to reduce the time and do surgery precisely and accurately.
That's awesome. I mean, so great to hear. And then can you talk just a little bit about how your practice meshes in a practice that is, I would guess, a lot of other dental alveolar surgeons? How have you been able to capture head and neck cancer patients in a practice like that?
Yeah. So we are in a very unique practice. I'm in private practice, and through private practice, I'm doing head and neck surgery. And one of the examples that was like kind of like I saw was where I did my fellowship. I did my fellowship in Portland, Oregon, and which is kind of like the example that you do advanced head and neck surgeries through a private practice, and it's possible. And now I see that there are other examples. And of course, you have to do this in a group practice. You can't do this alone. And to do head and neck surgery financially, also when you're doing a private practice, you have to look into it like how would you sustain yourself financially, how would you pay bills and stuff like that. So you
Yeah.
have to balance that. I mean, so that would be my advice. First, it's not impossible to do head and neck surgery through a private practice. You find the right practice setup, you find the right people, and you can do it. That's why I said I have set aside a day for dental alveolar implant surgery. I take call, I do trauma, and then I get to do what I enjoy, which is head and neck surgery, and I have set days for that as well. So it's possible that you can do it, but you have to do it efficiently. You have it because it's a private practice, right? It's also a business. You have to pay for expenses. So don't. If I'm a head and neck surgeon, I still do implants. I still do trauma and dental surgery as well. So that's kind of like maintaining a balance.
Yeah, and that's good to hear that you've been able to do that and have, you know, have been able to succeed both financially and clinically, um, but that you still are able to do the full scope of practice, even doing dental alveolar along with trauma and everything else.
Right.
Well, that's good. Any other advice you have for young surgeons? Probably a lot of the listeners on our podcast are residents or dental students, and a lot of them will reach out to me and ask me, what path I think they should take for their career. How do you counsel residents
Yeah.
who are not sure? Maybe they do think it's interesting to do head and neck pathology, but they don't know if they could do that full time and get through all the schooling.
Yeah.
What would you say?
Yeah, I think it's a very common question that I get, and it's a very personal one. And there are many factors that plays a role. What kind of path after residency you take? Do you do a fellowship or you don't do a fellowship? And if you do a fellowship, what kind? Craniofacial, cosmetics, or head and neck? And and if you go into private practice, what are the reasons to go to private practice and stuff like that? So I tell the residents there, like if they're not decided, one thing is first you have to decide if you want to do a fellowship or not, right? That's one thing, right? The other thing is like if if you have not decided doing a fellowship, and then that's totally fine. You don't have to do a fellowship. That's what I tell people. Like, don't do it because of emotions. Don't do it because you see someone they're doing it. Unless you're inspired by it, unless it's your passion, then do it. Because if you do it just for a reason, just because it's another year and it's cool or something like that, and then you don't enjoy it, you don't get to do what you want to do, or financially it's not stable, it's challenging,
Yeah.
it will be very difficult. So first of all, you have to decide why are you doing it. I had a passion to head and neck. That's why I did before I did my residency, I knew I wanted to do head and neck. So for me, it was very easy decision, and for some people, it's not. I mean, I didn't have that many loans for college. Only loan that I had was for dental school and the medical school. And I understand that when people are coming out of residency, they have like half a million, close to $1 million
Yeah.
loan. So that is a major factor. That is a major factor that people think that it would be difficult for them to go for another 2 years, not have an income, and invest that time. And rather than making money and paying loans and have that interest, I mean, I think that's a main factor these days, and quality of life that influences your decision. So I tell them, pick what you want: your passion, quality of life, and your finances. These three things will influence your decision, and then based on that, and also of course your personal decision. If you're married, what your partner wants, and then
Yeah.
location, family, everything, that that will influence your decision. But whatever decision you make, be honest with yourself, and then stick to it.
That's great advice. That's really helpful to hear, kind of break it down in those various categories and try to balance it all out. Well, good. I appreciate you discussing some of this. We end our podcast with some rapid fire questions.
Okay.
The first question I have for you is, what is the best book you've read in the past year?
What is the best book I read in the past year? Okay. Well, you're talking about like any book or
Yeah, any book. Do you read or listen to books or podcasts or anything?
not rarely. I'm taking my time.
No problem.
Yeah, just using reading articles and just and stuff like that, and looking into my cases, my past pictures, and stuff
Yeah.
like that. Yeah, so I think mostly that's what I do. Yeah, I guess I'm not setting a good example here.
You're one-sided. You need to branch out.
Yeah.
But that is good to be keeping up on articles. Next question is, what is the most helpful non-oral surgery thing that you do that can translate with your daily oral surgery skills?
Okay. Well, I play cricket. Yeah. So I'm being from Pakistani background. I grew up watching and playing cricket, and I still keep up with cricket, and I still play. There is a league team. I'm here in El Paso, Texas, and so I regularly play cricket over the weekends. Other than that, um, I bike. Yeah. So I think probably these skills are keeping me kind of like in a shape.
Yeah.
Yeah.
You road bike or mountain bike?
Mountain bike.
Nice. Okay.
Yeah.
I'm in Denver, so that's what we do. A lot of mountain biking as well.
Oh yeah, you're probably in the best place. A lot of good tracks up there.
For
Yeah,
sure.
but El Paso's not behind. El Paso's pretty good. Now, people think of Texas like flat, but El Paso is totally different. It's a high desert, and we have beautiful mountains and hikes, and lots of beautiful tracks here.
That's fantastic. Next question. What forceps do you use to extract tooth number 3?
It's whatever they give me.
Okay. For universal.
I usually use elevator. I use a lot of elevator. I use an elevator to like set the tooth, and just the upper. I forgot the number, to be honest. What is the number of the phone?
No problem. They make like a cow horn for the upper molars as well.
I use Kahan for the lower whenever I need to, but
Okay.
for the upper, I rarely use a Kahan.
Just the universal, maybe. Okay.
Yeah, universal. Yeah.
All right. How about, what's the best movie or TV series you've watched in the past year?
Best movie. You know, I'm very bad with remembering movies and TVs. But I did watch Horizon.
Okay.
Yeah, I really like Horizon, and also I like probably maybe similar theme Yellowstone.
Oh yeah.
Yeah, so I haven't finished it yet. So I've saw a few episodes. Yeah,
Nice.
I still need to catch up with it.
How about, what is your favorite quote? Do you have a quote or a mantra that you kind of come back to in your life?
Yeah, kind of. Whenever like you're stressed and something like that, I always think that this time shall pass.
Yeah.
Yeah.
I like that. That's a good one for residency, because
Yeah.
it can be very overwhelming.
I look back at the time when we were interns and kind of stressed with work and presentations, and now I look back. Sometimes I kind of like laugh about it, enjoy it. There's a lot of work to do, but trust me, zero responsibility. Yeah, I know it doesn't make sense when you are an intern or something like that. As you grow in your residency and then you're an attending, um, you may think you have less work, but you have a lot of responsibility, a lot of difficult decisions to make. So it's it gets easier with time, and you enjoy uh, all the benefits of the training, the hard time that you invested, and you get to enjoy a good quality of life, a good practice. You'll have enough time to spend with your family as well. So I think it's a very good feel. If I had to do it again, I would pick it again. Never regret it. I'll never regret it. It's amazing what we can do with our skills. You can do dental violar. You can focus on that. You can do uh, fellowships like I did, and some people decide to do, and cosmetics, of course, TMJ or oncology, craniofacial. It's just amazing what we can do with our skins and specialty.
Yeah, and I think, as oral surgeons and of course most surgeons, we're in a position to help people, a lot of people in pain, a lot of people suffering. So it is a blessing to be able to do that. I mean, just looking at your Instagram account and the various things online, it seems like you do a lot of that, a lot of helping of people that are in difficult situations. So
Yeah, I mean, I'm just honored and feel that I'm very lucky to be able to do that. So I mean, and the thing is, like, I and this is something that is rewarding in a very different way that you can't put any uh, like I say, it's of course financially, I'm I'm very satisfied. I'm doing really well. But this is something different. This is something different. The reward that you get for being able to help someone who are less fortunate, um, it's just so overwhelming, and that is something that just keeps you going. And I think probably the best reward that I get and from my profession and the skills that I have is when I get to help someone. So, and I hope it's for everyone. Everyone. It doesn't mean that you need to be a specialist or you need to be a head and neck train or craniofacial train. Anything that you can do for anyone. Someone is in pain, and then someone who walks into your office, they're in pain. They may not have the finances, but you make it happen. You help that individual, and I think and when they pray for you and the gratitude that they have, I think that's the most amazing thing.
yes. Oh, I completely agree. I mean, I think most jobs that you're helping someone in some way, but I think we're blessed because it's such a direct way of helping people, and we see very immediate, solutions and lives change so quickly. So it's pretty incredible, and I think we're all very blessed to be in this profession.
Yeah, I mean, getting someone out of pain, I mean, amazing. I mean, it's just so gratifying to see that.
Yes, totally agree. My last question is, do you have a power parenting tip? Do you have any tips for parents? Are you a parent?
I'm not a parent. Yeah,
Oh, okay.
yeah. But I have lots of nieces and nephews, and so for parenting, like for kids, I mean, like I'm very friendly and open with my nieces and nephew, and they look up to me. So I would say setting an example,
Yeah,
um, what you want them to be. First, be that person. Set an example. I think probably that would be my uh, advice to parents.
that is a great tip. Sometimes easier said than done, but yes. Usually kids follow the example more than they follow the words that you're saying. So I
Yeah,
like that. Well, Dr. Kaleem, thank you so much for taking the time to do this. If you're okay with it, I could put maybe your email or contact information in the show notes. Is
yeah,
that okay?
that's fine. That's fine. You can put my email or Instagram handle, whatever you need.
Awesome. So if listeners have further questions, they could reach out to you.
Right, of course.
But I appreciate you and good luck with all the work you're doing in El Paso.
Well, thank you so much. Yeah, visit us in El Paso. Yeah, I've been to Denver Are you in Denver? Proper
Yeah,
Denver? Okay.
yeah.
Yeah. Yeah. I love the weather. I think now it's getting cold. I can see you're wearing a your, your jacket. Yeah.
Already
So
cold.
yeah. 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 It's a beautiful city. So, and of course, again, thank you so much for inviting me and giving me the opportunity to talk about the work I do. So, thank you for providing me that platform.
No problem. All right. So have a good rest of your day. I appreciate you.
You too. Take care. Bye bye.
Bye. Thank you so much for listening to this episode of Everyday Oral Surgery. For more information on these podcasts, please visit everydayOralSurgery.com. I love feedback and would be very grateful if you would reach out to me via my email, grantstucki@gmail.com, and let me know what you thought of this episode. Or you can text me at 720-441-6059. Additionally, if you have any topics you'd like to hear about, or if you would like to be a guest on the podcast, please email or text me. I found many of my interviewees through people who have been contacting me and have been listening, and I've gotten so many great ideas for more podcasts, and that's what helps keep the podcast rolling. So I really appreciate you making that extra effort and helping me out with feedback and knowing what to do next on the podcast. Thank you so much.